Good afternoon, Facebook. I'm Jeff Kaplan from KSL Newsradio. We are live at 12 noon Mountain Time, and my guest is Utah State epidemiologist Dr. Angela Dunn. Anything you want to know about COVID-19 and the state's handling of the pandemic, the woman in the other box is the person to ask. You've seen her speak countless state briefings alongside the governor, and you can ask your questions here, and we'll try and get to as many of them as possible. And I want to take a moment before we start to thank the state of Utah. Thank you. Thank you to the Utah Health Department for helping make today's interview with Dr. Dunn possible. Doctor, how are you?
Good, hanging in there. Live to see another day, so that's a good thing.
It's been about, 2 weeks since we last spoke, and the daily numbers have gone up. Back then, when we spoke, we had fewer than 200 people testing positive each day. Now we're seeing 300, 400, 500 cases a day. What's going on?
The numbers today are especially sobering. We have, nearly 500 cases that we're going to report today, and we can't point this large increase in one day due to a single outbreak. A week or so ago, we had, numbers in the 400 and 500s that were mostly associated with an outbreak in a meatpacking plant, but that's not true today. And so, unfortunately, it is a sign that COVID-19 is just spreading more readily through our communities.
All right. Statistically speaking, is the increase in cases partially because Utah is doing more testing? We've heard that as a talking point, and I figured go to the source and ask, is that the case?
So, it's not exactly how it works. I know that's kind of counterintuitive that you would think, well, we're going to test more, we're going to find more people. And that's true, and that's what we want to happen. However, the percent of people that we're testing becoming positive is increasing. So, about a month ago, we were talking about 4% of everybody who was tested for COVID was testing positive. Now we're up to 8 and 10% of everybody. And because of that increase, it means that we're seeing an increase in spread. What we want to happen is to keep testing all these people, but then have that number of percent positive go down.
Some people point out that everybody's going to eventually get COVID. Everybody, unless we have a vaccine, and the state's goal should be simple: make sure we don't overwhelm the hospitals. Is that our goal, or are we trying to keep everyone from being sick forever?
Yeah, so our primary goal is to make sure that we do not overwhelm our healthcare systems. We want to make sure every Utahn can get the healthcare they need, whether it's COVID related or not. So that is a number we watch very closely, and we are bumping up against capacity right now with our increase in cases. However, in order to prevent people from even getting hospitalized, that means we have to have fewer people getting infected overall, because the less people that are infected in Utah, the less number of people that will become hospitalized. So those two metrics really go hand in hand.
What is our hospital capacity? I know at this moment, right now, we have about 150 people in the hospital with COVID-19. What's the capacity?
Yeah, so we look at it in terms of percentages, so how much of all the beds are being utilized. So right now, for our ICU beds, overall statewide, about 60% of them are being utilized. And that gives us capacity and kind of room to have a buffer in case there's a surge. But with these increasing number of cases, we're going to see more COVID-specific hospitalizations. So I'll give you an example. Again, a month ago, before we had this increase, we were seeing about, every day about 90 people being hospitalized due to COVID. And like you said, now we're up to about 1. So it is concerning. And that just makes it so important for us all to take responsibility and really do what we can to prevent the spread.
Okay, I want to put this question up on the screen. I see so many people wearing masks incorrectly. Why have we not done some sort of education campaign so people will understand the proper way to use and remove a mask?
Yeah, that's a great point. When we go and start promoting face masks, the person is absolutely correct. It's so important to learn how to put them on, wear them correctly, and take them off, so that you're not just having more chances to touch your face and contaminate yourself. So that's a great idea. I know we're working on a big media push now around face masks, and I'm sure that'll be part of it.
Another question from a viewer: Are we going to go into lockdown again? If the numbers get sufficiently bad, is the political structure going to say, yeah, we have to shut it down?
That's been a conversation that we've been having constantly in terms of when would we ever go back to, orange or red? And those are ongoing conversations. Of course, it is a very dynamic environment right now, and it's going to take political will, the economic indicators, as well as the health indicators to all come together to make that decision. And thus far, there hasn't been, a very concrete decision on that yet.
I'm not going to put this one up on screen because I don't want to, give the name. But thank you for your hard work, Dr. Angela Dunn. And it just went off screen. There it is. Have you seen any kids with special needs fare okay with COVID? My daughter is special needs with a chronic lung disease. Obviously, a concern.
Yeah. Yeah, that's a really tough situation. We've been lucky in Utah and across the country that we just haven't seen a large number of children overall being infected with COVID, and then even a smaller number with special needs being infected. So I don't have really good, solid data to give you, but I do know that you're in a tough position because a child with a lung disease will certainly be at a higher risk for severe infection. So that's why, again, it's so important that we all take the precautions necessary to prevent ourselves from getting sick or spreading it, because it's people like your daughter that we need to protect.
Okay, I'm going to take a deep breath because we're going to dive into masks now. Okay. And, this is obviously a hot button topic. Yesterday on my show during the afternoon, there was a drama next door in Arizona, whether the governor was going to come out and announce that masks are mandatory. Would he, won't he? In the end, he didn't. He kicked it to local communities because they have an incredible hotspot in Arizona, or hot spots. I think Tucson is particularly bad. Are you following all this?
Yeah.
Okay, so this viewer asks, there seems to be substantial proof wearing a face covering helps reduce the spread. Why in Utah are we resistant to requiring people to wear masks? Simply asking and suggesting does not seem to be working. Dr. Dunn, first of all, do you think it's working in Utah?
I mean, I certainly think we can do better. I do think we need to normalize mask wearing. If we want to continue opening up our economy while saving lives and preventing unnecessary illness, we have to start normalizing mask wearing and also normalizing social distancing when we can and staying home when we're ill. These are things that will allow our economy and our physical health to survive. In terms of, mandating them, that's out of the Department of Health's job responsibilities and duties. We don't have that authority. That's what I was looking for. It's out of our authority to be able to do that. And so we provide the evidence to our state leadership. And for example, we know that Colorado has recently published some really good evidence. They actually mandated mask wearing in some of their communities and have seen a good drop in cases. I know mask wearing probably wasn't the only thing, but it is a tool in our toolbox in terms of preventing the spread of COVID-19. And so from my point of view, I really think that we need to normalize it and do a better job here in Utah of everyone wearing them when they're in public spaces.
The question on the screen from Lauren, would you recommend avoiding going to businesses where customers and employees are not wearing masks?
Yeah, I mean, that's tough. It depends on your own individual risk level and comfort level in taking that risk. I mean, everything we do moving forward until we get a vaccine is going to have some element of risk in terms of being exposed to COVID-19. So what I really want to make sure is that the public has the information at their fingertips to make the best decisions for them and for their families. And what we know is that COVID-19 spreads well when you're inside in a crowded space for a prolonged period of time. That's when COVID can spread. So knowing that information, take into account your own risk level and what that environment looks like and how much risk you're willing to take personally.
That's a squishy number, prolonged period of time.
I know.
What is prolonged?
So, when we're doing case investigations, we consider close contact within 6 feet for over 15 minutes. So it depends on the environment. But if you're in an environment where you're kind of in a really crowded situation indoors, I would say 15 minutes would be a risk for getting infected with COVID-19.
Okay, summer turns to fall. The kids go back to school. And are they going to have to wear masks in class?
Yeah, so this is something, so the Utah State Board of Education is working really closely with the local education agencies and our local health departments, and of course the State Department of Health to determine these guidelines. So that's something we're discussing. No decisions have been made yet. There are a lot of kind of pros and cons and different thought processes out there. So we're making sure we're bringing together the education experts, the policy experts, but we also have some pediatricians with expertise in infectious disease helping us make these decisions as well.
There are a lot of events around the state that have been canceled this summer. I mean, it's a bummer. Pioneer Days and Ogden, Days of 47 parade like that. But some events happen, like the protests a couple of weeks ago.
Yeah.
Did that play a role in the spike that we're seeing now?
Yeah, it's really hard to tell. We've actually only identified one individual who could have possibly been exposed at the protest. And that's because that individual didn't have any other identifiable, exposure to a large event or an ill person with COVID. So with the opening of an economy, people have multiple exposures. So it's tough to really nail down kind of, you got it at this point if you've been to multiple places within the incubation period. So my answer is, I just don't know, but it might have caused some increased cases, but it's not the cause of our current cases. So right now the spread is statewide and in places where there were no protests, and it's continued beyond the incubation period. So while we might have had some cases result from that, it's not responsible for the current numbers.
I'm seeing a lot of questions scroll by about kids and concerns about kids at risk. And one of those risks is asthma. So many children have asthma in Utah. And a simple question, children with asthma wearing a mask something we should worry about?
So there are, a few guidelines out there about children and masks, and especially with asthma. We need to make sure, first and foremost, that their asthma is controlled, right? And if wearing a mask increases the risk of an asthma attack, certainly don't do that. And what's more important is for the people around the child with asthma to be wearing face coverings in case they are ill with COVID and they don't know it. So preventing spread to the ill children is going to be really important moving forward.
Let's talk about testing for a moment. If you want to get tested at this point in Utah, can you get tested?
So for testing for active infection for COVID-19, we still recommend that you have a reason to get tested because that's what makes sure that we can trust the results and that we continuously have enough supplies and resources to test those who need it. And that includes people who, of course, have had close contact with somebody with COVID-19, have any symptoms, no matter how mild, consistent with COVID-19. And we also have some high-risk settings where employees and workers like first responders or those serving in long-term care facilities can get tested a little bit more regularly because of their high risk of exposure and spread.
Question about the numbers, which are going up. And you just mentioned it hasn't been released yet. So I guess this is first word that we got close to 500 cases, 500 people testing positive today. And we get this question. I run soccer camps. We don't do them for June. Many parents were upset. We're scheduled for July. Shall I ask if their children have asthma also? What do you do if you run a youth program?
Again, it's all about making sure people have the right information about what's going on and the risks out there. I think it's really important, for all these youth programs that we find out safe ways for them to continue. We know the kids need it, and so do the adults. And so really making sure that we have good screening and practice. We make sure that kids who have any symptoms or around anybody with symptoms don't come. And then using good hand hygiene will definitely help. But we do have guidelines on the coronavirus.utah.gov website that details out a little bit more specifically about camps and youth sports and what recommendations we have for them specifically.
I have to make an admission. I talk to state people and health department and the CEOs of medical corporations all the time. I never got myself a state issued mask. It was about a month later when I finally filled out the thing, and I'm still waiting. So I have a handmade mask that my wife made lovingly, and I wear it everywhere. Is it a waste? Same question. Handmade masks, okay or pointless?
No, they're definitely okay. So what we're doing when we're wearing face coverings is we're preventing the kind of large droplets when we talk, cough, or sneeze from going out and landing on someone else and infecting them.
So wait, when I see people on Facebook saying they're absolutely useless, everything goes right through. True, useless, is that just idiotic Facebook stuff?
Yeah, it's definitely misinformation. So they're not useless. Droplets can still definitely get through these homemade masks. However, we are preventing a significant number of droplets from getting through. So the risk of you infecting someone else is lowered by wearing a face covering, and that's important.
Can you get I can never say antibody or antibody. How you say it?
Antibody?
Okay.
I don't know, probably either way.
More important, can you get an antibody test if you want one?
Yeah, so they need to be ordered by a provider. And that's really important because interpreting the results of an antibody test can be pretty tricky. And so making sure that you're speaking with your provider about your history and your risks so that you can interpret it with the right information is important.
So we have this alarming number of cases today, close to 500. It's the second time we've hit 500, isn't it?
Yeah, so today I think they're going to be at 495 officially. We hit just over 500 when the meatpacking outbreak was occurring.
Okay, so what's the number? People are guessing, I see, as they ask their questions, whether there's a threshold, a certain number that you hit, and we have to lock down, go from yellow to, let me see, I have to remember, back to orange.
I know, back to orange. Again, these are conversations that are ongoing with the governor's office and other state leadership. From a public health perspective, we do see value in increasing restrictions as we're in this acceleration phase because it helps us keep those cases low. However, health isn't the only thing that is being impacted right now. And so it really does take a team of experts to come to the table to figure out holistically what is the best policy moving forward.
I have to compliment you because with your job, shoveling out these statistics day after day, you can, I don't know if you're old enough to remember the Saturday Night Live character, Debbie Downer, but that could be you, and you've managed to avoid this. But you're at a point where you're announcing 300, 400, and 500 people a day. How long theoretically would it take to go from this 400 or 500 cases a day to becoming a national hotspot? I'm not talking about the number that makes you a hotspot, but could it happen in a flash? Would it take 3 months?
You know, it's exponential at this point, right? So for every individual out there that's ill with COVID-19, you have a higher risk for even more people. So the bigger the pool of people that are infected, the more people are going to become infected. So at the numbers we're at right now, I mean, we're seeing it, right? A month ago, we were at, 150 cases a day. Then we were at 200 to 300, and now we're seeing 400 to 500 all within 1 month. So it is certainly a concerning trend.
Okay, so maybe that helps to answer this question. Salt Lake is, by Utah standards, a hot spot.
Sure.
Right? I'm in Davis County, just across the line in another county. Yeah. It's been quiet here. It's one of the safest places in the country. They're right next door. We intermingle. We work together. Why isn't it here? Why is it there?
Yeah, and actually we're starting to see increases in all counties, including our rural counties now, but of course not to the numbers that we see in our urban centers. And it's largely just by the biology of the virus, right? It spreads by people being in close contact with each other. So in our urban settings like Salt Lake County, it's just going to spread more readily. And when you have a denser population and more people living together, you're going to get those higher numbers. So I think it just has to do with the biology of the virus and the way people are living in a specific county.
Well, you've mentioned outside is better than inside. So what about Lagoon? Is it safe? Is it smart to go?
Yeah, so Lagoon it's really important to not go if you have any symptoms at all, or if you've been in close contact with anyone with symptoms. Lagoon is taking necessary precautions to limit spread so that people can still enjoy going and having fun while limiting the risk. But as I mentioned before, everything we do moving forward until we get a vaccine is going to have some element of risk. So really be aware. Yeah, no, I was just going to say, be aware of the risk that's out there and educate yourself on that.
What about swimming pools? I'm seeing questions about pool parties. Can you jump in the water 6 feet apart and everything's cool?
Yeah, so, I always have to preface this by there hasn't been a lot of studies to show if there's spread within pool, but I think it's really reasonable to assume that the chlorine kills COVID-19. So when you're going to a pool, really have a lot of precaution on the pool deck, when people are intermingling outside of the water, but I don't think COVID's going to stay in the pool and infect you that way.
Okay, we're getting a lot of questions about yellow versus orange versus green. Where are we right now? I mean, I got lost in a blur on the color wheel. Are we yellow still or green?
So the majority of Utah is at yellow. I believe Kane County is green and Salt Lake County is orange, or Salt Lake City is orange, excuse me. So it is a little bit of a patchwork, but overall we're in yellow.
And somebody just asked, schools. I'm not sure what the question is, but it seems as I scroll through this, there's a lot of concern about kids for 6 and 7 hours a day sitting in a classroom together, that it's bound to be a problem. Now, there were some comments about, or some studies about children not being able to transfer the illness to their parents. What about that? True, discounted? Where are we?
Yeah, we're just not seeing that nationally or in our own Utah outbreak. We aren't seeing many kids being that index case that is transmitting it to others. And so there is good evidence out there that we can, open schools safely. And it's really important that kids return to school and get the education they need and really protect. What we're going to focus on is, of course, protecting the staff and the teachers there. So again, we're working with public school education and the private and the charter schools across the state to really work on a plan to do this safely.
I know you promised us 20 minutes and we've now gone past that. I thank you for that. So I'll wrap up with just a few questions about masks. Yesterday, the governor unveiled the new state plan, the 4.0 plan, and he said all the economic stuff that he's talking about hinges on social distancing and wearing masks in public. Have you seen over the past 2-3 weeks that there's been an increase in the number of people wearing masks?
Yeah, so me personally, no, but I literally go from my house to my office, which are about 5 miles apart. So, but from what I'm hearing from people is that, in general across the state, people are having, COVID fatigue and not taking it as seriously as maybe we were at the beginning, which is really it's tough. And we're trying to figure out how to message this because right now the risk of COVID-19 infection is higher than it's ever been. And the need to wear face masks and social distance is more important than it's ever been in this outbreak. So really urging people to try to stick with us. I know it's hard and we've asked you to do a lot, but you got to give us a few more months of this so we can really turn the corner.
Okay, now there are a lot of people who say it's a violation of their rights, yet no one is telling them to wear a mask. It's merely being requested. So there's not much to discuss there. But the people who argue cloth masks are useless, it's N95 or bust, and why bother? Could you give the best argument for putting on that cloth mask when you go outside?
Yeah, again, any covering over your nose and your mouth is going to prevent large droplets from going from you to someone else and potentially infecting them. So while it doesn't completely eliminate the risk, it does decrease it. And in some instances, decreases the risk by 80%. So when we're seeing 500 cases a day, if I can decrease that by 80%, that means my hospitals won't be overwhelmed. We'll have an ICU bed for everybody that needs it. And that is the most important part about wearing a face covering.
We've kind of been all over the map, because that's what a Facebook Live session really is. You answer the questions, and many of them have come up multiple times, and you can review this video on Facebook afterwards to hear Dr. Dunn's answers. I want to thank all of the viewers who've submitted questions. We hope to some extent that we've answered them in these 20 minutes. I want to thank the state of Utah and the Utah Department of Health for helping make this interview with Dr. Dunn possible. Dr. Angela Dunn, thank you so much for spending the time with us. We really appreciate it.
Yeah, it's a pleasure. Thanks so much. Have a good afternoon.
Everybody stay safe. Wear a mask.
Yes.
Thanks for watching.